Does prescription Narcan save lives or condone illicit drug use? By Kelly McEvoy. The New York Times printed an article in July 2016 titled Narcan Saves Lives, but is no cure in the heroin epidemic. This is a controversial ethical topic that has frequently been in the local as well as national news. According to the Centers for Disease Control, 13,000 people died in 2015 from heroin overdoses, but an even more alarming statistic is overdose deaths from prescription opioids that has risen to more than 33,091 in 2015. Bazazzi, Zoller, Fu, and Rich, 2010, described areas concentrated with vulnerable populations suffering from health disparities as the highest occurrence for overdose dependence and related deaths. The Centers for Disease and Control report that Narcan reversed more than 26,463 overdoses between the years of 1996 and 2014. Regardless of Narcan's proven efficacy in preventing deaths with timely administration and the opioid epidemic continuing to grow, only 22 states have expanded the distribution and use of Narcan by non-medical professionals, which I believe is because drug users have been long stigmatized and remain a target for discrimination. In June 2016, Governor Cuomo signed a bill to combat the opioid and heroin overdose epidemic in New York State. The governor and legislative leaders reached an agreement on multiple bills that include new programs and insurance reforms to improve treatment options for individuals suffering from heroin and opioid addiction. One provision is opening opioid overdose prevention programs. The definition of an opioid overdose prevention program is a program with the purpose to train individuals to prevent a fatal opioid overdose in accordance with these regulations. The bill defines the word individual even further as a person other than a licensed healthcare professional, law enforcement personnel, and first responder who has been trained to administer an opioid antagonist. Essentially, a nurse working for an overdose prevention program may be responsible for teaching an individual how to properly administer Narcan. Beneficence, fidelity, and justice are ethical principles with potential conflict. Dougherty and Portillo 2015 describe being faithful to a patient as meeting their reasonable expectations, one of which is treating all patients with basic respect, which could be challenging for a nurse being put in an ethical dilemma of giving Narcan to an addict who has caused himself an overdose. To explain beneficence, the nurse is in a position to benefit the patient by giving Narcan to an overdose patient, or sharing their knowledge to educate individuals on properly administering Narcan. By doing this, the nurse is practicing the principle of beneficence. I've dedicated this slide to discuss social implications in relation to social justice principle. According to Dougherty and Portillo, societal disadvantage creates health disparities, and a disproportionately small allocation of resources goes to the disadvantaged groups. Considering overdoses are linked to vulnerable populations suffering from disparities, healthcare professionals have a moral obligation to help eliminate such disparities. This begins with a commitment for more inclusive societal arrangements. Narcan must be made easily accessible to these communities. Additionally, the location of these prevention programs needs to be accessible by the vulnerable population. The social impact is that there needs to be a balance between societal responsibility, such as government-sponsored policies regarding access to Narcan, and the addict's personal responsibility for their health. Nurses are held in high regard in society. Therefore, when nurses are considering getting involved in a civic issue such as this, Dougherty and Portillo suggest balancing the urge to act with your own humility regarding the extensiveness of your knowledge base. How would I address this issue using the 6-step ethical decision-making model? In step 1, I would gather relevant information. Things I want to consider. Does the new bill consider the principles of justice and equity? What's the addict's accessibility to Narcan in the prevention center locations? Do all members of society have equal access? What's the cost? How many overdoses has the individual had? What's the plan, their access to rehab or long-term health help? Any research evidence supporting this, databanks or registries? And I would assess my own feelings prior to starting. Step 2, I would identify the ethical problem. This topic has been publicly debated regarding whether or not Narcan accessibility condones opioid addiction or saves lives. This is an ethical dilemma because a nurse educating individuals close to an addict on proper Narcan administration could certainly save the addict's life. but does it provide such a safety net that they don't get help with their addiction? Additionally, the nurse may suffer from moral distress as a result of not knowing what the morally right course of action is. Narcan and prevention centers will lead to a desired course of action by decreasing death-related overdoses, but without overdose fear, will the number of addicts increase, or will addictions become more severe? Will this just become a cycle for addicts instead of truly addressing the underlying problem? In step 3, I would utilize theories to analyze the problem. Duties related to upholding the principles fidelity, beneficence, and justice support utilizing a deontological theory to analyze the problem. In order to uphold my duty related to the principle of justice, I must also consider fairness and equity. The theory of utilitarianism can also be used for this dilemma. Essentially, if I uphold my duty of principles, fidelity, beneficence, and justice, and all persons are treated equally with equal access to treatment, then my actions will be morally right because they will bring about the best good and least harm when lives are saved. Step 4. Some alternatives that I think would be effective are mandating rehab programs for individuals who receive Narcan for overdose or prescription Narcan, or possibly developing safe administration centers where individuals physically go to this facility to get high or use drugs. They are allowed to do this without criminal actions, but with medical professionals present to intercept an overdose if one occurs. According to Campbell 2015, safe injection sites already exist and have shown effectiveness in other countries. Step 5, I would complete the action by becoming an active member of policy decision-making processes. Taking both financial stewardship and each patient's well-being into account, the current bill that was passed is the most appropriate course of action. However, justice needs to be enforced by improving addicts' accessibility for treatment and prevention centers. If outcome measurements indicate increased incidence of overdose, a safe administration center may not be a bad option to explore in the future. The bill should also enforce rehab programs and support groups for addicts. Step 6 is to evaluate. Things I would want to know. Were vulnerable populations appropriately labeled? This is important to ensure the placement of prevention centers and improve Narcan accessibility. If areas where vulnerable populations were inappropriately labeled, this bill would be less effective. Was there a decrease in overdose deaths? Was there an increase in overdoses where Narcan had to be administered? How many addicts had repeat overdoses? How many addicts are in long-term rehab? These are all important outcomes to measure as it will indicate the new legislation's bill's effectiveness, as well as provide data indicating areas that need improvement. In order to properly assess the effectiveness of the new bill passed, research will have to be conducted on human subjects. A professional will need to collect data regarding the Narcan intervention and follow up through interaction with the individual. Private identifiable information will be recorded and need to be protected. According to Rogers and Lange 2013, drug addicts are a vulnerable population who have been exploited in the past, therefore need extra protections above the usual protections offered to participants in research. 5 provisions of the ANA Code of Ethics are applied. Provision 1. The nurse practices with compassion and respect for inherent dignity, worth, and unique attributes of every person. This is seen by treating the vulnerable population consistent with the way I treat all patients. Provision 3. Equally promote, advocate for, and protect the rights, health, and safety of all patients, consistent with what I explained in 1. Provision 5. The nurse owes the same duties to the self as others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth, seen by sharing my knowledge and educating individuals on proper Narcan administration. Provision 8. The nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. The goal of this bill is decrease health disparities and overdose deaths in vulnerable populations. Provision 9. The profession of nursing, collectively, through its professional organizations, must articulate nursing values, maintain integrity of the profession, and integrate principles of social justice into nursing and health policy. Nurses working collectively with policymakers to reduce disparities among vulnerable populations by making Narcan and prevention centers accessible exemplifies social justice integration into nursing practice.